and 5 and 6 and 7.
You're doing good. This is helping him until rescue arrives. Compressions again, and then 2 breaths of air, and repeat this until the medics take over. I'm going to stay on the line until they arrive.
When fire rescue comes to your house, we send a lot of people. We will overwhelm you. We bring a lot of equipment with us. This is a normal fire station response. There's 6 people here. What they're doing is they're dividing up the work. There's a lot of things they want to do in a short period of time. We're doing CPR. This gentleman here is starting an IV, which they'll be giving resuscitative medications. This gentleman here is doing something called intubating. He's putting a tube into the trachea so we can ventilate the patient and breathe for them. This gentleman's doing CPR, as you can tell. The big guy in the back has got an EKG monitor. That monitor alone can defibrillate. It's a pacemaker. It's an EKG monitor. It'll monitor oxygen levels in the bloodstream also.
Got an 18.
We could be there up to 20 minutes or a half hour before we go to the hospital, depending on if we can stabilize the patient in the home or en route to the hospital. What we've done is we basically brought the emergency room into our house.
Stop CPR, bag the patient. Atropine on board. Negative epigastric. Clear left. Clear right. We're yellow and yellow.
Good.
Pulse ox is 91 and rising. CO2 is 35. We're in the zone. Keep it up, boys.
He's checking the patient's blood sugar. Sometimes when people are alone or when their family members are in distress, we don't know if they have a history of diabetes, if they've ever had a heart attack or a stroke. It's also a good idea to have a list of your medications already printed out, a list of your medical history.
Narcan on board. Captain Narcan at 1048.
Narcan's on board.
Hold the patient. Stop CPR. On your count. 1, 2, and 3. Check the back. Check the back. Back's clear.
What they're doing now is they're securing the patient to a backboard. The backboard's going to go on the stretcher. The stretcher goes in the rescue truck, which is outside, and then off they would go. From here, they would go to Delray Hospital.
Got a good radio pulse.
Stop CPR for a second. Stop CPR.
What's that rate?
Got a rhythm.
I got it from Laurel. 60 beats a minute.
All right, in this scenario, which since we control it, we can have a good outcome. This patient regained a pulse, so they can stop doing CPR. Now they'll get medications to make sure that the pulse stays there.
1, 2, 3.